first, what's an EMT?
It's a lower level certification, a lot more limited in your scope and skills and what you can do. To give an example, my EMT course was like a 6-credit college course, what it was.
So you became an EMT in college?
No, I actually attended a course when I was a senior in high school.
Okay.
And
so maybe let's start there, just in terms of what your training was, first in becoming an EMT, and then what you went through for that.
I attended an EMT course at Ridgewater my senior year of high school, Ridgewater College in Hutchinson, and I started on a volunteer ambulance out where I grew up. And
was that while you were still in high school?
Yeah, kind of. Pretty much as I was graduating, I started that.
So you said that there's an additional training path, an additional certification that's required to become a paramedic. Is that right?
Yes.
So did you do that immediately afterward, or was there some time in between?
A little time in between. I started my paramedic course, would have been 2012 in May with HCMC, and then graduated in May of 2013.
So you went through training to become a paramedic at HCMC from 2012 to 2013, is that what you said?
Yes.
And what does that training entail to become a paramedic?
There's a lot of book work and a lot of hands-on skills training, clinical ride-alongs on ambulance and different clinicals throughout the hospital.
Is that a year-long training?
Yeah, the whole course was a year.
And did you complete that successfully?
Yes.
Is there additional testing or certification requirements you have to go through to become a paramedic?
Yes.
Can you just describe that a little bit, please?
There's a written exam that we have to take to get our certification, and also a skills exam.
And did you complete that in 2013?
Yes.
And what about to maintain your license or status as a paramedic? Is there continuing credit or education you have to go through?
Yeah, we have to recertify every 2 years.
And are you up to date on all that certification?
I am.
So let's talk about your job sort of on a day-to-day basis. What do you do as a paramedic at Hennepin EMS?
I work with my partner on an ambulance. We respond to 911 calls, primarily medical emergencies, and provide care to our patients and transport them to the hospital.
What kinds of calls do you get? You said medical calls. Can those vary?
Yeah, and anything somebody would call 911 for.
Have some of those calls been life-threatening type emergencies?
Yes.
Have some of those calls been cardiac in nature?
Yes.
Drug overdoses, things like that?
Yes.
Other types of things? What else would you respond to?
I guess mental health problems is included in that as well.
Okay. And what is your primary objective? What is your job when you go out to a scene as a paramedic?
To provide the best care I can for my patient and bring them safely to the hospital, the appropriate hospital they need to go to, and also advocate for them when I need to.
And when you say advocate, what do you mean by that?
Just making sure that their complaint or their problem is heard and communicated effectively to the receiving hospital as to why they're in the emergency room.
So when you're talking about advocating, is part of your process as a paramedic to hear and understand what the patient needs and is going through and pass on that information to the hospital?
Correct.
I'm going to direct your attention to May 25th, Memorial Day of last year. Were you on duty as a paramedic with Hennepin EMS on that date?
I was.
And was there a call that you responded to that evening in the area of 38th and Chicago.
Yes.
What was the nature of that call? How did you become aware of it?
We were dispatched. We have our screen where we get our calls on. We were dispatched, and our notes said we were going code 2 for someone with a mouth injury, and PD was on scene.
And when you say code 2, what does code 2 mean?
Routine, so no lights or sirens. Normal driving.
So you said routine and no lights or sirens. Does that, what does that indicate to you in terms of the criticality or how serious that call might be?
It'd be pretty low criticality.
Okay,
Yeah.
so,
No life-threatening indication if we're going code 2.
Okay. Where were you coming from when you heard about this code 2?
We were downtown at HCMC when we got it.
And did you get into your ambulance at that time, assuming you were responding to a code 2 call?
Yeah, I believe we were already in it, but...
Okay.
Yes.
Did the nature of that call or did the code level of that call change at some point?
It did about a minute and a half after we got it, I believe.
And what was the change?
We got a note saying code 3, so upgraded to lights and sirens, emergent response to the scene.
Okay. And at that point in time, did you have any more information about what the code 3 was?
No, not at that point.
So did you proceed as if, while you were en route, did you then upgrade in terms of your response to a code 3?
Yes.
Meaning, did you turn on the lights and sirens?
Yep.
Okay. And ultimately, did you arrive at that location, the 38th and Chicago location?
We did.
What did you see when you arrived on scene?
As we were pulling up to the scene, saw multiple officers on the side of the road with our patient lying on the ground next to a squad car.
So, as you were pulling up, was that the position that you observed them in, meaning the officers on top of the patient next to the squad car?
Yes.
Could you tell at that point, as you were approaching, what the situation was, or what the condition of the patient was at that moment?
No, there were multiple officers on top of the patient when we pulled up at that point. We assumed, I assumed that there was potentially some struggle still because they were still on top of him. So
Okay.
that was my assumption when we pulled up.
So when you got to the scene, having no additional information, seeing what you saw, that's what was going through your mind, is that right?
Yeah. Yes.
So when you got to the scene, what did you do next?
Parked the ambulance near the patient and got out. I walked to the back of the ambulance and my partner walked over to check on the patient.
And what did you see when you got out of the ambulance in terms of the patient's condition at that point?
I was standing a little ways away, so I couldn't get my partner would have a more accurate description of his condition at that point, but from what I could see where I was at, I didn't see any breathing or movement or anything like that.
Did he appear to be unresponsive to you at that point in time?
From what I could tell, just standing from a distance, yes.
And was he in handcuffs?
Yes.
And we're describing the patient here. Was that patient later identified as George Floyd?
Yes.
So When you got out, your partner first approached, is that right? What were you doing at that initial point in time when you first got there?
As he went over to check on the patient, I was watching him to kind of get a cue on what we were going to do next, because we're still determining what the patient's condition was. So I was kind of waiting for him to go check on the patient and then know what to do next.
And at that point in time, when you were standing outside and your partner was approaching the patient, did you see a struggle of any kind going on, any movement, anything like that?
No.
Okay. So after your partner first approached, did you see what he was doing?
Yeah, he checked a pulse on his neck, a carotid pulse, and also looked like he checked the patient's pupils.
And did you discuss with your partner at that point next steps?
Yeah, he walked back towards me, and I asked, is he in cardiac arrest? And he said, I think so.
So, you use the word cardiac arrest. What does that mean?
It's the term we're going to use for anybody that's not responsive, not breathing, and doesn't have a pulse currently.
Okay. So, essentially, does that mean that someone's heart is stopped?
Yeah.
Okay. Are there multiple things that can cause someone's heart to stop?
Absolutely, yes.
Okay. So when you say cardiac arrest, you're dealing with a patient whose heart is stopped. Is that an emergency?
Yes.
Okay. So what did you guys, knowing that you had an individual, George Floyd, in cardiac arrest, what did you decide to do?
My partner said, let's just get him in the truck. So I unloaded our stretcher to bring to the patient to place him in the ambulance.
And what was the reason for getting him into the truck?
Yeah. All of our equipment at that point was in the truck for resuscitating the patient. And we also didn't have Minneapolis Fire there yet, which they work with us on critical patients like that and help us a lot. So kind of for resource management, we needed to get in the truck. And then on top of that, there was also a crowd of people that appeared very upset on the sidewalk, and there was some yelling and stuff. And in my mind at least, we also want to get away from that, because running a cardiac arrest, it takes a lot of mental power and focus, and it can be taxing on our abilities, so we want to do that in the optimum environment we can. And since the ambulance is right there, we want to be in that controlled space to start resuscitation.
And was part of your reason to move, as you described, to give the best care you could so that you could be focused and away from whatever distractions were happening outside?
Yeah.
And you described hearing people, yelling or loud voices, but was there a physical fight or anything like that happening while you were there?
Not that I saw, no.
Okay. But you decided it would be best for the patient to move to a controlled setting and do your work on the ambulance, is that right?
Yeah, and all of our equipment was there, yeah.
And when you also mentioned fire, tell me why it's important to have fire assist in a situation like this.
There's just a lot of different skills we're going to be doing on a patient to try to resuscitate them, and we work closely with Minneapolis Fire. They're all EMTs, and they work with us on resuscitating a patient, doing things like breathing for them with like a BVM to help the patient breathe, or do chest compressions, stuff like that. Okay,
so I'm going to break down some of the things you said. You used the term BVM.
Sorry, yeah, it's a thing you squeeze to breathe for your patient, essentially.
To assist with if someone's not breathing, is that a part of the process to try to resuscitate
Yes.
the respiration?
Yes.
All right, and we're using the word fire. I assume we're talking about the Minneapolis Fire Department, is that
Yes.
right? And in a lot of people's minds, the fire department fights fires, but you're describing they're also EMTs.
Yeah.
So is it typical for them to assist you with a patient who's in extreme distress or a cardiac arrest or something like that?
Yes, it is.
And you said that there's a lot of work to do. Maybe you could just explain a little bit for the jury why it takes so many people. What's the process that you typically go through when you're trying to resuscitate a patient in that state?
We're doing things like chest compressions to hopefully circulate blood through their body, and you also need to control their airways. So there's some sort of airway has to be placed, and we have to breathe for them. We need to gain vascular access to like an IV or something, so we can give medications to try to resuscitate them, as well as cardiac monitor, which is going to be monitoring a couple different things, but mainly their heart rhythm.
And to do all those things at the same time, I assume you would need more than one person at least.